Cardiovascular disease is the #1 cause of death in women. It actually causes 1 in 3 female deaths. So if you think of 3 women that you know, 1 out of every 3 women will die from heart disease. It is actually the leading cause of death in women, more so than in men. So while men and women both die from heart disease, more women die every year than men do. And it is a cause of death more so than breast cancer, other forms of cancer combined. So cardiovascular disease is a very important topic for women to be aware of, as again, it is the #1 cause of death, and it will be the most impactful for most women's lives. Cardiovascular complications of pregnancy matter both at the time of pregnancy and after pregnancy later in life. When a woman is pregnant, high blood pressure is a signal that her body did not deal with what we like to call nature's best stress test. And that's a sign that later in life she will be at increased risk for heart disease. So a female who's currently pregnant who has any of those hypertensive disorders of pregnancy, gestational diabetes, or peripartum cardiomyopathy, we'll treat at that time, but then also follow lifelong to help decrease the risk of heart disease in the future. And I think it's actually related to microvascular changes in blood vessels in the placenta that cause some of those complications, which of course puts them at risk for having those microvascular complications later in life. We don't actually know if pregnancy causes these events or just unmasks these events. We do think that it's actually that pregnancy is showing that these microvascular issues are there and potentially can cause problems later down the road. We don't have the data yet to tell us either way. There are cardiac conditions that women tend to experience more frequently than men do, called MNOCA, and that's myocardial infarction with no obstructive coronary artery disease. So those are those types of heart attacks we talked about that are not due to a big blockage in a coronary artery, but are in fact due to something else. So there was heart muscle damage, but there was no big blockage that caused it. The most common MNOCA are microvascular dysfunction. So that's instead of having a blockage or a disorder in a big blockage of the coronary arteries, it's the little arteries in the heart that have caused the problem. Those women have exact same symptoms as people who have big blockages, they just don't have those big blockages. Additionally, Takotsubo cardiomyopathy or broken heart syndrome is also found more frequently in women. That is a stress-induced or catecholamine-induced cardiomyopathy, meaning the heart pumping function has decreased in some way due to a huge stressful event, this catecholamine surge. And that again tends to be seen more frequently in women than men. Spontaneous coronary artery dissection is another etiology that again is seen more frequently in women and normally women of childbearing age.